ado, I'm going to invite my panelists on stage and ask them to join us. So Michelle Mitchell, who's the CEO of Cancer Research UK. Please join me in welcoming her on stage. Jean-Christophe Tellier, CEO of UCB. And Alexandra Heumber, CEO of Rare Disease International.
Okay.
Awesome. I'm supposed to sit there. Would you mind? I'm supposed to sit on the side. So why do we have these three CEOs from seemingly divergent backgrounds? It's interesting, right? So I am going to ask them a basic question, because what we heard was that today healthcare is a challenge. And climate is changing things. And it's about bringing a lot of stakeholders together. So I am going to start with Jean-Christophe and ask him to share with me, from his standpoint, what are some of the critical connections we need to make to get the innovations to the patient?
Well, thank you very much for the question, and thank you for the invitations to share the stage with a different perspective, which I think is important. So, when I think about healthcare, I do think about a necessity to build a coalition, a network, a kind of a value chain. I mean, you can use the word that you want, but it is a lot of things that needs to be connected together. This is one element. The second element that I would like to transmit and you to keep with you is health is very precious. And so health needs to be considered as an investment, not as a cost. And very often, health is considered as a cost. So if we shift the approach, and if we really are thinking about how to invest in something which is so precious and so important for society, so that we can build a better future for the next generation. And the third message, maybe to start with, is when you think about health, you think, of course, about medicine. You think about treatment. But you need to think about everything that needs to be connected in order to deliver the value that medicines can deliver to people who suffer from disease, which mean education, physician, logistic, environment, priorities. And so these are the components of health that need to be deeply connected, that need to work together with different stakeholders in order to deliver the best outcome.
Brilliant, thank you. So actually, that's a perfect context setting, which allows me to ping it to Michelle. You run a cancer nonprofit, is that correct?
It is, yes.
And how does that work with these connections and everything? Cancer is unique. Cancer is, how do you unparcel it? How does that work? Will you share a little with us?
So we are Cancer Research UK, and we're the largest funder, independent funder of cancer research in the world. And we're supported by millions of people in the United Kingdom through corporate partnerships, through philanthropists. And what unites us all really is a deep golden thread which tells a story and belief and hope that together we will beat cancer through research. So we're funded largely by the public. We fund world-class science, research, innovation and translation in the UK, but increasingly around the world. And what that has been able to demonstrate over 120 years of our history is the role that citizens can play in improving cancer survival across the world. We've been behind 11 new cancer treatments that have been brought to the market to benefit cancer patients, and we have 30 million people who come to us for information, half of whom come from around the world to help them through their diagnosis and treatment. So not-for-profit is a really important part of a broader ecosystem. For us, it's about ensuring that not only we deliver lasting change, but we increasingly acknowledge the link between climate and health. And when people think of climate change, sometimes they don't think of cancer, but it's important to do so. It's often the people who are displaced because of climate change who are left behind. And as we see global warming, we see both the incidence of cancer rising, particularly around skin cancers and extra vulnerabilities there. And most recently, our chief clinician, Charlie Swanton, published a groundbreaking global research report which demonstrated the links between pollution and cancer, which we know is on the rise right across the world.
That is absolutely fascinating. And I'm going to circle back and talk a little more about pollution and cancer, because we live with it every day, and yet we don't talk about it. But before that, I'm going to go to Alexandra Heumber, and her title itself makes me want to talk Rare Diseases International. Yet you're sitting here on a climate stage. Please help us, share your journey, make that connection for us.
Thank you. All right, so Rare Disease International, it's the organization that represents patient organization across the world. So we are a patient organization led. And we have the mission to really represent our patients and to influence the ecosystem, to influence in order that the right policy are in place to ensure that the patient with rare diseases have access to treatment and care, and have also the social policy in place to help, notably with their disabilities. So we are talking about a vulnerable population, because even though we are more than 300 million, and it's a very reserved number, more we will have diagnosis, more, I guess, we will have patients that will increase the number of rare diseases across the world. And so it's a vulnerable population. So when there is climate issues, then the vulnerability of that population is increasing. We have patients in low and middle income countries, so in low income country, that to get a treatment, when there is a treatment, just to recall that only 5% of the rare disease have treatment. So let's say that 99% of our patients seek for care only at that stage. So when they need to have some care, sometimes they need to do huge transportation, during the whole day. So imagine with very high heat, well, their journey is going to be even more difficult. So we do not see right now we don't have study right now showing the direct impact of climate and rare diseases, but I'm sure that is something that we will look out. But you can imagine that overall it's going to make the life of the community even more complicated. So I hope I make the link as you ask me here.
Thank you, absolutely. I'm going to bring it back and ask you to talk a little more about the pollution link.
Sure. So there are many modifiable risk factors for cancer. The single biggest one is smoking, of course. So, we continue to research and campaign to ensure that selling tobacco products is outlawed in the United Kingdom. And I would say, obviously, the global impact of the tobacco industry on the world and climate is significant, as well as on human health. But in relation to pollution, what we've seen more recently is significant research and scientific papers led by Professor Charlie Swanton, who is at the Crick Institute and UCL in London, which very clearly establishes the link between pollution and cancer. We think 1 in 10 lung cancers in the UK is a result of outdoor pollution. So it's one of those areas to watch very closely. The research is building as we speak, but has massive implications for the populations worldwide.
Thank you. I'm going to bring it back to Jean Tellier and ask him, what are you seeing for UCB and some of the challenges you're facing as you build this ecosystem in the face of climate change?
Well, first of all, it's important for everyone within the company as well as outside of the company, but to understand what is the impact of what we are doing on the planet and what is the impact on what we are doing on the climate. So even if you can consider that pharma businesses per se, and medicine productions and discovery per se is not maybe a massive contributor to the degradation of the environment. Understanding what is the impact and making sure that we are respecting the planet we are all sharing and living in, I think it's the first component. You know, for an innovation pharma company like us, people who belong to this company and to belong to this industry, their purpose is we need to have an impact on society. We want to have an impact on people suffering from disease. And for them, initially, it's say, when you think about sustainability, this is good enough, in a sense, right? And the notions of what else can we do was kind of secondary. So integrating all of that into the main purpose of a company, it's a journey from scientists to people who are doing some development, and to convey also to that journey the companies and the partners we are working with. So understanding the impact on climate change on health is, of course, critical from an innovation standpoint. But it's also important and equally important then to make sure that what we are doing doesn't have a negative impact on the planet. And that's the journey we are in.
Beautiful. Thank you. So one of the things that all three of you brought out was that there is no standard patient. Yes? And we see consistently there is an inequity in access. Alexandra, you talked about it, and Michelle, you've talked about it, and so have you. So for each of your different, realms that you deal with, whether it's cancer, rare diseases, or even pharma, talk to us about this inequity and some of the challenges you see for your industry. And we can go any which ways. Should we start with you, Alexandra?
Okay. So I just mentioned earlier that actually only 5% of the rare diseases, so there is more than 7,000 rare diseases, just to say. Only 5% have, for example, treatment. So we really need more research. We work closely with our pharmaceutical partners, including UCB. We have an alliance of companies, and ADI really has the, I would say, mission to ensure that the dialogue is constantly going on with the different partners. We really believe in multi-stakeholder partnership. Specifically in rare disease field, we won't be able to achieve anything working in silo. So it's even more than ever needed in that specific disease area to work together. And there are some initiatives, actually. And ADI really want to highlight even more what is going on. So that community is extremely driven by the patient themselves, in working with also the private sector, and we really seek to increase even more public-private partnership. There is a problem of financing, so the equity in rare diseases won't be able to progress, so basically people or patients won't be able to have access to treatment when they exist if health system cannot finance those medicines. There are medicines that are highly innovative, and we are going to go even further on that line with the gene therapy, with precision medicines. And health system, as you know, have many different other priorities. So one of the challenges is to ensure that health system, including France, including Brazil, where every country can really take in their decision when they decide their budget for health, integrate rare diseases. They can also look for innovative public-private partnership. There is a need for that. A health system in Africa will not be able to embrace or encompass those price of medicines when they will be there. And I'm not talking even of the part of the rare diseases, of the patient living with rare diseases when there is no treatment. Here we're talking about care, because it's one thing, a treatment, but it's another thing, everything that goes together. In many rare diseases, the pill is not enough. You need all the infrastructure that goes with it. You need the health worker. But if countries do not have the capacity to invest, we will not resolve the problem of equity and access. So ADI notably advocate at the highest level in the United Nations. We now engaging very intensively with the World Health Organization to develop a global action plan on rare diseases. It starts with policy change. But it's not enough. Even country with beautiful national plan, with beautiful commitment to make a change, won't do it if there is not the budget and the finance that follow that. So if there is one call today, it's really ask investors to think also innovatively with member states, with private sector, with the patient organization to really find some innovative way to finance health, including rare diseases.
Awesome. Thank you. Go.
So when we think about
good, right?
cancer inequalities, one of the statistics that might surprise you, in the United Kingdom, deprivation results in 33,000 more cancer deaths. So think about that. People die because of deprivation and the link to cancer. People are more likely, if they live in lower socioeconomically deprived areas, who smoke, are in poor housing, often diagnosed late, and have a worse experience going through the national health system. So cancer inequalities are critical to our mission and our purpose, because everybody has to benefit through the world-class research, translation and innovation that's out there. Nobody should be left behind. But when we think about our mission, we also think about our role in the world. Three examples I would want to give you briefly. One is we have recently, with the National Cancer Institute in the United States, launched a Cancer Grand Challenge looking at global cancer inequities. Some of you may know that much of the genomic data and information that's available is based on European ancestry. Think about that, based on European ancestry. So a £20 million project with researchers from around the world focusing on African ancestry and looking at what potential implications are for prostate, breast and pancreatic cancer, first of its type in the world. Second, really, if you think about in the United Kingdom, we have the great fortune of being able to say we believe cervical cancer will be eliminated as a public health issue in the United Kingdom. We funded research 40 years ago into the underpinning science, the clinical trials, the options around screening, and influenced our government to ensure that girls in school are vaccinated, and now boys. A major study was produced in 2021 which showed that we've seen a 90% reduction in the incidence of cervical cancer amongst those girls first vaccinated. And whilst I am extremely proud of that, it really, really breaks my heart that when we think about cervical cancer around the world, fourth most common cancer in the world, there's a vaccine available and women are dying because of poor access to vaccinations which are available today. And I think what that does for us is not ensure that we only look at cancer inequality through a domestic lens, but look at how we can work in partnership with others, including in Nigeria for us, where we've had a really successful partnership developing the vaccination program there for HPV. But look at inequalities and cancer inequalities around the world, because if we're going to beat cancer for everybody, it requires research, innovation, translation, public-private partnerships, cancer patients, and of course, the great goal here is to see cancer survival increasing all around the world.
Thank you.
I mean, I would like to build on what Michelle and Alexandra just shared with you. I mean, first of all, something which is, of course, maybe obvious for many people. To get access, you just first need to have the medicine available, right? I mean, to have access to a treatment, you need this treatment. So creating an environment, a society that supports through public-private partnerships, through an ability to create these partnerships, to work together, this ability to really create an environment that stimulates and supports innovation is really critical. The second element is to realize that it's not because you get the solution, and it's even not because you get access to the treatment that you have solved the problem, that we have solved the problem. We do not have solved the problem. As Michel and Alexandra have shared with you, there are areas where the treatment exists, but unfortunately, it's not accessible for certain part of the globe or certain part of patients' population due to social inequity. And even in area like in France, where basically when the treatments are available, they are fully reimbursed, and basically you can consider that access is possible. There are still a significant part of the population that should be treated, that should get the benefit of the treatment, that didn't get it. Why? Because there is an element of trust in the system, there is sometimes an element of education, there is an element of network, how to make sure that you can identify the person suffering from the disease is particularly important for rare disease. And it's not that easy for a person suffering from rare disease to be connected to the appropriate network, have a good diagnostic on time, to be able to get a treatment when the treatment exists. So this equitable access means few things. One, innovation. Two, making sure that the medicine is available, but also recognize that it's much more complex than just the questions of availability. You need to get an environment that makes sure that all of the patients will be treated and we do not leave any patients behind.
Thank you. I think that is the mantra of the day. How do we create that ecosystem where we leave no one behind? So let me ping that back to you and ask you, what do you think is the role, we're hearing throughout this conference roles of technology, artificial intelligence, in increasing both education, access, awareness. So maybe I start with you. Do you want to go first? Or is it artificial ignorance?
I like the artificial ignorance.
I'm borrowing.
No, it's great. Look, quickly, because I don't want to capture too much of the time. On AI, there are a few elements. One, I think it's a wonderful opportunity to make sure that we can focus on what makes a difference and allocate tasks to the systems to make sure that we get there. And when I translate that into a biopharma type of model, we can think about that into three components. One is research. Accelerate ability to find new targets and shorten the time between target and medicine and candidate. So artificial intelligence help to accelerate, to identify the target, and to shorten the time. Two, better understanding patients' population. We need to go, and personalized medicine is a great example of that. We need to go to populations, to individuals. In the end, each patients are different, understanding the difference, being able to be more predictive. But what are the criteria that will predict if a patient will be a responder or not? AI may create a huge transformation there. And three, it's patient experience itself. We have heard, we have some great example of that, connecting the patients to the physicians. Today, 90% of the dialogue between a patient and a physician is a face-to-face dialogue. We still not have enough tool to make sure that we optimize this moment, which is not very long, when a patient has thousands of questions. Some of that can be answered through a digital platform and really create the link with the physician, which is a different link than what it is today. I was last week in a hospital looking and observing a consultation with a physician, and I realized that 90% of the time of the conversation, the physician was not looking the patient, he was looking his screen. And he was already getting the data into the system, and I looked at the patient in front of him, and the patient was kind of constantly trying to get the attention of the physician. AI should be able to, let's put that on the side, let's do digitally what can be done digitally, and let's rebuild the trust and the human relation, which is so important into a good care.
That is brilliant, thank you. Alexandra, Michelle, would you like to add some?
Well, just in agreement briefly, I mean, technology, data and AI have a huge opportunity to help us understand cancer better. Only a couple of weeks ago, a major study supported by AI discovered that prostate cancer isn't one disease, there's two subtypes. brand new discovery being supported by technology, but it also can help us prevent, detect, diagnose cancer earlier. It can help us develop new candidates, new treatments, and perhaps expanding on a theme you touched on the end there, Jean. Many of us are in healthcare economies which are suffering from long waiting lists, rising costs, stagnant or declining health outcomes. And we think there's a huge opportunity for AI to support productivity of people, making sure the most highly skilled people are doing the most highly valued work that adds the greatest impact value for patients. So AI, it's here. It's affecting all aspects of cancer research, prevention, diagnosis, and treatment. And it affects how we think about how we run our own organization. And I would just want to say, on the point of climate change and health, we've talked about cancer, but actually as a leader of one of the world's largest not-for-profits, it's absolutely essential that I run and lead my organization in a responsible way that's mindful about the planet and about health. And we've gone on quite a big learning journey to understand what our impact is on the climate, and taking important steps, not least around our investments, which are now fully ESG, looking at the role of our pensions, how we influence other researchers and universities, given we're such a large research funder. So we're connecting planetary health, human health, being a responsible organisation and citizens, not just for today's generations, but for tomorrow's as well.
Thank you. That is beautiful. Alexandra?
Yeah, I think it's, honestly, I'm not going to repeat what Michelle just said about the value of AI for diseases, but I would say that for rare diseases, it's even more, in a way, relevant, because one of the main challenges for rare diseases is the lack of data, because more than 7,000 diseases. Imagine how much somehow we need to know for each disease. Many of the practitioners do not know all the rare diseases. So we believe that with AI, for example, it will really help to increase the diagnosis. One of the main hurdles for rare diseases patients is the time of diagnosis. How many years they spend to one practitioner to another one that do not know, think it's in their head, think it's something else, etc. So we really believe that AI will help to minimize the time for diagnosis, because there will be more knowledge about rare diseases, and Agge is really working on this global network for rare diseases, for example, where we really want to put experts and centers of excellences around the globe together to speed up that time, notably of diagnosis. The other thing that it will help is to identify the patient. It's very important. It will help also our partner, private pharmaceutical company, to enroll patients in clinical trial, for example, and the algorithm, etc. I'm not going too much into the details here. But one thing also that I would like just to highlight is the fact that there would be ethical question where patient organizations need to be around the table with policymakers, with private sector, and with AI company to make sure that the privacy, for example, of data, the ownership, etc., all those questions are addressed in the right way for patients. It means patients need to be empowered with their own data. This is their data. So this is a big, important issue that Agge will follow closely, again, with our partners, having that dialogue all together and finding the best solution. Thank you.
Thank you. Please give it up for all our three amazing panelists who have brought us on the journey.